Most of us are pretty comfortable assessing adult mental status, but when we get to pediatrics, it can be a little more challenging. Older children, we can probably assess fairly well, but we get to younger children and infants, and it gets a little more difficult. So I want to just talk about a few tips for you going through my class that will help you when you are assessing pediatric patients out in the field. Now, the pediatric assessment triangle was really designed for children. In fact, my first encounters with it, it was called the pediatric assessment triangle. And the idea is that once you start getting your hands on a small child, because of some stranger anxiety, they are going to begin to act a little bit differently. So they're going to start to cry or fuss, and it's just going to be harder to get a good assessment. So the patient assessment triangle is sometimes called from the door assessment. So when you first walk through the door and you look at the child, you can assess them without really them being upset yet. And we look to see if they are crying normally or any speech. And remember that a crying child has a clear airway, so that's a good thing. We like to hear children that are crying. It lets us know the airway is open and clear. How do they respond when the parents talk to them? Do they look at them? Do they seem to be comforted by the parents any? How are they moving? Are they limp, or do they seem to have normal muscle tone? Are they moving their extremities well? All this helps to determine their mental status. And then how do they act when you arrive? A little bit older kid, do they look up when you come in? If it's an infant and you start to get in their field of view, do they respond at all, look at you? Just what is their normal response to you? Now, AFPU is about the same as normal. Are they alert, respond to verbal stimuli, painful stimuli, or unresponsive? And then we still try to get a Glaucoma scale on our infants and children, although this can be a little more challenging again. Adults were pretty comfortable with this. With kids, there's a couple of different versions of this, and you can look online, you can look in your textbook to see a couple of variations on the same scale, but ideally we're going to get a motor, verbal, and eye response from our children. And then we can look at something called Tickles. So this is similar to our patient assessment triangle. What is their tone? How are they moving? Are they limp, lethargic, or are they able to sit upright? Do they seem to be normal? Are they irritable? Or if you start to mess with them, do they become more irritable? If they are irritable or upset, can the parents console them, or is a favorite toy able to calm them down, get them their teddy bear and see if that helps? You see that in the video here, this baby will look up and look at you. That is something to check to see if they can respond to verbal stimulus and see if they look up like that. And then if they are old enough, what is their speech like? Their speech pattern, can they say the words? How is that compared to normal? And I always do our ABCs. Now, in addition to, well, really not in addition, but sometimes we don't think about the D and E. So the disability, we want to do a neuro exam on them. We're going to check their pupils, and we're going to see if they're moving all the extremities and if they have some response when we try to stimulate a hand or a foot and see if they maybe respond to some tickling or a little light touch. And don't forget to expose and look at their abdomen and back, specifically for rashes and hives and things that might give some clues as to what could be wrong with them. If they have some rashes, then we're worried about some sort of infection, and infection, they could be septic or it could be like a meningitis that's affecting their mental status. And then just a couple other quick tips. You got to get around some kids. You have to know what norms are for different ages, and you can study the charts in the book to see what different norms are for the different ages and how they respond to people and what their normal development is supposed to be. Like you don't expect a 6-month-old to be running around the house, but just know what the normals are and vital signs. Know those normal vital signs. Make sure you're involving the parents or caregivers. And we oftentimes say that when we have a pediatric patient, we have at least 2 patients because you'll be taking care of the child and you'll have the caregiver there. And they can provide a wealth of information about how the child normally behaves and what is different. And if a parent or a caregiver ever says that the child's just not themselves, that is something to note and take seriously. Lastly, depending on the age of the child, you might be able to ask them to do some simple things like, can you touch your nose? Can you wiggle your fingers? Can you pick up a ball? Show me your favorite toy, and see if they can respond to that. And that will allow you to get some idea of their mental status. Things like we normally would ask an adult, like what's your birthday or who's the president, don't work quite as well with a kid. So something simple like touch your nose, touch your ears, pick up a ball, show me your toy, all good things you can do to help assess mental status. So I hope this gives you a few ideas on how we can better assess our pediatric patients versus adults. I know it can be a little challenging, and I hope this helps.